You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org.
Accountable Care Organizations Improving Coordination of Care is AAPCHO's latest podcast series exploring the concept of accountable care organizations, ACOs, and their impact on community health centers and the patients they serve. Dr. Peter Shin is an Associate Research Professor of Health Policy at the School of Public Health and Health Services at George Washington University. In this two-part episode, we listen in as Peter shares key findings from his research on ACOs and their potential impact on both providers and patients with AAPCHO's communications assistant, Beverly Quintana. Peter, what is the message you want viewers to walk away from this podcast with?
In general, let me just say that the ACO concept is an amazing concept. We're really pushing for integration and can be a win-win-win situation for providers, payers, and patients alike. But the Medicare regs need to address some key challenges of its own design. Let me present the way that we sort of phrased our findings in terms of why the regs should reconsider treatment of health centers, why ACOs should want them in their network, and what it means to exclude them. First, health centers are a critical source of care for low-income elderly. In our report, we found that between 1996 and 2009, health center Medicare patient population grew by 124%, while the number of low-income Medicare population nationwide only grew by 2%. Approximately half the health center Medicare populations are also dually enrolled in Medicaid, and that population is twice as likely to be poor health and requiring ongoing care management. And I think having them in an integrated system like an ACO would have greatly improved their chances of good health outcomes. Second, many ACOs should want health centers in their club. More health centers are seeking certification as patient-centered medical homes. Many already have an electronic health reporting system. They all have experience with addressing population health and operate some type of registry on top of their EHR. And they provide significant cost savings despite the high-risk patient population. In other words, ACOs are getting some pretty advanced and ready partners in the form of health centers. And so by limiting and disincentivizing FQHC participation, the ACO really doesn't do much to impact access and quality in underserved communities. And for the millions of low-income Medicare patients served by health centers and rural clinics, the ACO model would definitely have strengthened linkages to other healthcare resources, but because they basically exclude meaningful participation by these providers, that bridge virtually stops at the footsteps of underserved communities.
Could you expand on how it affects patients?
I mentioned in terms of greater access to provider networks, greater access to coordinated benefits and specialty providers, specialty care, behavioral health, greater potential for quality improvement and health outcomes, and real meaningful deduction overall than in healthcare expenditures. And so ultimately what you should see is quality and better health outcomes being driven by greater integration and coordination and not determined by cost-cutting measures or what they would think is something that would really be more of a priority to cut healthcare expenditures.
Great. Thank you, Peter. If the podcast audience wants to find more information about your analysis or anything that we've talked about today, do you have any resources you'd like to direct them to?
We have a bunch from the George Washington Geiger-Gibson program in health policy. We have over a dozen articles related to healthcare integration. We also have at George Washington University the Health Reform GPS, which tracks some of the current activity, including the ACO regulations. And that project is funded by RWJ. And certainly our partners in terms of the RCHN Community Health Foundation and the Kaiser Family Foundation and the Commonwealth Foundation have done a number of projects, and we're continuing to do a number of projects for them.
Peter, thank you again for taking the time to speak with us today.
Sure. Appreciate it. Thank you.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.apcho.org. And tune in for our next podcast at www.aapcho.org.